Welcome to this explainer by Next Level Speech and Physiotherapy Center. I am absolutely thrilled to be your guide today as we walk through our specialized clinical approach to helping your child finally find their voice. Look, if you're a parent who's been frantically searching for answers about your little one's speech development, take a deep breath. You are in exactly the right place. Let's dive right into this.
In our daily work with families at the clinic, we hear this exact sentiment over and over again. We truly understand the profound heartbreak of knowing exactly what your child wants to say while having to watch them physically struggle to form those words. You see that intention shining right there in their eyes, right? But the words, they just don't come out, or they come out completely differently than they meant them to. And of course, they might get incredibly frustrated the harder they try. Well, if this sounds familiar to you, it's actually a really critical clue to what might be going on. I want to assure you right from the start that you aren't navigating this alone. We've been at this a while. With over 11 years of hands-on experience supporting more than 7,000 children and their families, our dedicated JBR clinic team has the deep pediatric expertise to guide you through what is, frankly, a pretty complex journey. We've walked this path with so many families across Dubai Marina and beyond, and we know exactly how confusing and exhausting the road to a diagnosis can be.
All right, Section 1, Understanding Motor Speech Disorders.
So what is childhood apraxia of speech, or CAS? Well, the first thing to know, and this is absolutely crucial, is that CAS is not caused by weak speech muscles. Your child's muscles are likely perfectly fine. Instead, CAS is a motor speech disorder. This basically means there's a disconnect in the brain's ability to translate the intention to speak into smooth, accurate, and coordinated muscle movement. The message from the brain to the mouth is literally getting scrambled along the way. In our clinical experience, we love explaining CAS to parents using a dance metaphor. Imagine a dancer who knows the steps. Actually, scratch that. It's more like they have memorized the entire complex choreography perfectly in their head. They know exactly what they want to do, but when the music plays, their body simply cannot execute the steps in the right sequence or at the right time. The child absolutely knows what they want to say, but the breakdown happens right there in the translation into movement.
This brings us to a huge point: how CAS differs from other speech sound disorders. This fundamentally separates CAS from a regular speech delay or a general articulation disorder. You see, with a typical speech delay, a child makes errors that follow a very predictable pattern, like they might always substitute a W for an R. But with CAS, that breakdown in motor planning means the errors are incredibly inconsistent. The very same word might come out completely differently every single time they try to say it.
Moving on to Section 2, Recognizing the Signs.
Because CAS is so fundamentally different, spotting its specific hallmarks early on is vital, especially since it's super easily confused with other developmental delays. In our comprehensive assessments at the center, our team looks for very specific red flags. We dig into your child's history for things like limited babbling as a baby, or maybe babbling that suddenly just stopped. We look for words that miraculously appeared once and then seemingly vanished forever. We listen for that wild inconsistency we just talked about, along with unusual rhythm and stress patterns in their speech. You might even notice your child's speech actually gets worse, not better, when they are trying harder to communicate.
Now, here is a totally fascinating phenomenon we consistently find with the children we support. You might notice your child speaks way better when they're just on autopilot, like when they're happily singing along to a familiar nursery rhyme or counting to 10. But the exact moment they actively try to communicate a specific intentional thought to you, the speech just breaks down. And this happens because automatic speech uses completely different neural pathways in the brain than intentional, formulated speech. Pretty amazing, right?
Okay, Section 3, our expert assessment approach.
Diagnosing CAS accurately requires a highly experienced ear and eye. A quick 5-minute observation simply won't uncover the root issue here. Our comprehensive assessment process is incredibly thorough. It kicks off with Step 1, which is you. The history you provide about when the difficulty started and how they've evolved is vital. Then, Step 2 moves into rigorously analyzing your child's sound production across all sorts of tasks: single words, repeated phrases, spontaneous speech, and we are specifically hunting for that motor planning breakdown. Finally, Step 3 concludes with a clear, honest explanation of our findings and a realistic, step-by-step strategy for moving forward. Getting this diagnosis right the very first time is absolutely critical. As we always emphasize to our families here in Dubai, clarity is the foundation everything else is built on. Without knowing exactly what we are treating, we just can't build an effective roadmap for your child.
Which leads us directly into Section 4, Targeted Therapy That Works.
A precise diagnosis matters so much because if your child does have CAS, standard articulation therapy methods simply are not going to work. Instead, effective CAS therapy requires something entirely different: intensive, high-repetition practice of precise speech movements. Think about it. We aren't just trying to teach a child a sound. We are trying to literally build brand new motor plans in their brain. It is all about intensive motor learning.
That's why our clinicians utilize highly specialized, evidence-based principles. We use approaches like dynamic, temporal, and tactile cueing. We just call it DTTC for short, and the Nuffield Dyspraxia program. These have the absolute strongest evidence base for CAS. We're basically helping your child build muscle memory for speech, much like a musician learning a really complex piano concerto through focused guided repetition. Doing general, run-of-the-mill speech therapy just won't cut it here. Let's break down exactly what our approach looks like in practice. Because frequency matters immensely with CAS, we structure treatment plans around intensive sessions. We're definitely not just practicing random words. We focus on a very carefully selected set of functional targets. On top of that, we provide precise tactile and visual feedback to help your child's brain map out exactly how their lips, tongue, and jaw need to move. The ultimate goal? Accelerated motor learning.
And that brings us to Section 5, Partnering for Real Progress. I always tell parents the work we do in our clinic rooms in JBR is truly just the beginning. What happens at home, between those sessions, is what truly drives lasting progress. But don't panic, we make this incredibly manageable. We empower you with highly specific, easy-to-follow home practice tasks that take only about 10 minutes a day. We'll show you exactly how to do them so they fit seamlessly into your family's daily routine without adding extra stress. That consistent daily repetition, that's the secret ingredient.
Now, I want to be incredibly honest with you about the timeline here. This journey requires patience. Progress with CAS rarely follows a straight line. Often children go through periods of what we call invisible consolidation. This is where progress is absolutely happening beneath the surface, rewiring the brain, even if you can't quite hear it in their voice yet. But with consistent, targeted therapy, children absolutely do progress through these stages to achieve meaningful, intelligible speech.
We also recognize that CAS doesn't always happen in a vacuum. Sometimes it presents alongside other developmental conditions like autism or Down syndrome. And when it does, our holistic clinical approach ensures every single aspect of your child's communication profile is expertly supported. We look at all the pieces of the puzzle so we can plan therapy that addresses each one appropriately. It's about supporting the whole child, always. So, I want to leave you with one vital, incredibly important question. If you have spent months in therapy without seeing meaningful progress, is your child's therapy actually targeting the right diagnosis? If the signs we've talked about today feel a little too familiar, it's time to ask if your current approach is truly addressing motor planning. We warmly invite you to reach out to our expert pediatric team at Next Level Speech and Physiotherapy Center for a fresh assessment. Let's get you that clarity and give your child the targeted support that you both truly deserve. Thank you so much for joining me for this explainer today.